All right, it is 6 o'clock, so I will call to order the April 8th Community Mental Health Program and Budget Committee. And before I read our mission statement, I'm going to turn it over to Macomb County Clerk Fred Miller to do the official swearing in.
Thank you, Mr. Chair. So today we're going to swear in four new and reappointed board members, Kathy Vosberg, Christopher O'Connell, Selena Schmidt, and Nick Shimatero. I'm assuming everybody's here. I have written oaths from Christopher O'Connell and Kathy Vosberg, and I understand through Kathy that the written oaths for Selena and Nick are on their way. So we'll keep an eye out for that. So I'm going to go ahead and read this. Just repeat after me, and it'll be a little bit strange, but we'll go through it really slowly. So raise your right hand, if you would, and repeat after me. I state your name.
I, Nick Schmidt,
Do solemnly swear
do solemnly swear
that I will support the Constitution of the United States
that I
will support the Constitution of the United States
and the Constitution of this state,
and the
and the Constitution of this state,
and I will faithfully perform the duties of
and I will faithfully perform the duties of
Macomb County Community Mental Health Board Member
Macomb County
Community Mental Health Board Member
according to the best of my ability.
according
to the best of my ability.
Congratulations, everyone. Thank you for your service.
Thanks, Fred.
Thank you.
Thank you, Fred. We appreciate it.
Thank you.
I think that's the first virtual swearing in ceremony I've ever participated in, so nice job.
Likewise.
All right, next we will move on to the reading of our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. And with that, I will take a motion to adopt the agenda.
Motion to the adopt.
Motion from O'Connell, support from, I believe, Lori.
Nope, Selena.
Sorry, support from Sleta. Thanks, Sleta. Seeing no questions on the agenda, all in favor signify by saying aye.
Aye.
All opposed? The agenda is adopted. Next, we will move on to hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. If you are in the Zoom meeting, click the raise your hand button, and if you are calling in, just chime in and I will call you guys in order that I hear you. Anyone for public participation? Public participation going twice. And public participation for a third time. You will have a chance at the end of the meeting. There is another opportunity if you miss this chance. Seeing none, we will close the hearing of the public and we will move on to item 5A, a request to approve issue short-term contracts for office-based opioid treatment providers for opioid health home services. Take a motion to approve.
Motion to approve.
Support.
Who was the motion from?
Fantuzzi.
Thank you. Motion from Fantuzzi. I think support was from Burke.
Yep, sorry.
Okay, great. Can you guys give me your names afterwards? Helen is here, I believe. Helen, did you want to speak to this, or Dave, either one?
Nope, I'll leave that up to Helen. Helen, you have to unmute yourself.
Okay, I'm unmuted.
There
Yes.
you go.
Thank you. So as you may recall, probably about last August, the board approved Macomb County Community Mental Health accepting the opioid health home grant funds from the state. So the purpose of this grant is to provide an opioid health home project for people in Macomb County who have Medicaid or Healthy Michigan. So the request here is that we've already have providers on panel that have been licensed substance abuse programs and providing medication-assisted treatment for us for a number of years. But new to this grant is also bringing on individuals who operate under office-based opioid treatment services. So that could be federally qualified health centers. It may be individual physicians or physician practices. So we did a search based on some information we got from the state of anybody providing those services within Macomb County. And we looked for any practice of serving more than at least 20 people in Macomb County. So we had a list of about 18 potential available providers. We reached out, contacted all of those providers to see if they had any interest. 6 met with us to get more details on what the project was. And out of those 6, 2 have presented an interest in moving forward with us, as well as meeting the qualifications from the state to be approved as an opioid health home. So therefore, we're recommending contracting under the grant period with Gammons Medical, and they're located in Warren, and My Care Health Center, the federally qualified health center, which they're using their Mount Clemens office.
Great, thank you. Any questions for Helen?
Yeah, this is Nick.
Nick, go ahead.
Helen, you've got 2 contracts here. You have 1 contract, a short-term one, and then you've got an RFP for the same thing.
Mm-hmm.
And the short-term is for what duration?
That would be for the remaining of this fiscal year, so through September 30th during the grant period. And then beginning October 1st, it would move over to a fee-for-service under Medicaid reimbursement model, which is why we would be issuing the RFP for that period of time going forward.
So how were these 2 chosen for the short term?
As I mentioned, we did have a list of providers that were serving and providing opioid medication treatment within the community. So we took that list and went through that list and contacted anybody that was serving at least 20 people we were looking for. And then of those, as I mentioned, we had 6 that showed an interest, met with us, got more information. And then only 2 said they were prepared and ready to start moving forward on the project at this time.
Gotcha. Thank you.
Thank you, Nick. Any other questions? Any other questions from board members? All right, seeing none, we have a motion and support. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Next is item 5B, a request to approve proposals for office-based opioid treatment providers for opioid health home services. Take a motion to approve.
Motion to approve.
Motion from Lori,
Support for Brian.
support from Brian, I believe.
Sure.
Helen, did you want to mention anything?
Well, as a little bit addressed already, we discussed internally about opening up the project to more potential providers once it becomes fee for service. So we thought we would issue a request for proposals and offer it up to more. Maybe a few of those who weren't quite ready yet might be in the near future. But this way we are really looking to expand this panel as much as possible, because we do have such a large opiate issue within our county.
Okay, great. Thank you. Any questions on this item? I don't see any. All right. We have a motion and support. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Thank you, Helen.
Thank you.
Next, we will move on to item 5C, request to approve new computer servers for CMH internal files that are locally stored. I'll take a motion to approve.
So moved, Burke.
Motion from Bert,
Vosberg support.
support from Kathy. Go ahead, Dave. I don't see Bill, so it's all you.
This falls under preventative maintenance. This was in the approved budget for 2019, and we're just now getting to where we're making the purchase. We did migrate to the cloud for the Outlook services, so our emails and things like that are now stored in the cloud. Our electronic medical record is through PCE, Peter Chang Enterprises. and that's stored off-site. But locally, primarily for the Word documents, things that we're producing and keeping here, we store those on our own servers, separate from the Macomb County or anything like that. Our current servers are outdated and need to be upgraded. So this is just part of that planned maintenance on those servers.
Thank you, Dave. Any board members with questions?
Phil,
Yes.
I don't have a question, but Linda Bush is muted and doesn't know how to unmute.
Star 6.
Got it?
Hello.
She's unmuted now.
There she is.
I was not, Phil unmuted me. There, Phil, you've always wanted that button, haven't you, Phil?
It's really helpful. I believe it's star
Thanks.
6,
Thanks,
Linda, in
Kathy.
the future on your end.
Oh, I just thought it was the phone mute, and I knew it wasn't muted there, but okay, thanks. Star 6? Okay, well, regardless, is Helen still on the line?
Yes.
Yes.
Could we just have, and you know, I know you're not prepared for this, so the best you can, a report on how the people who are receiving SUD services are faring in this COVID crisis? You know, in terms of getting their medicine. I'm on some Facebook pages with some people in recovery, and they were talking about long lines around the building at one provider where they had to wait for hours and no social distancing. And that could just be a rumor. I really shouldn't have even said that, but could you just tell us a little bit what your experience or knowledge is of how they're doing with this?
Sure. Our providers have really, done a wonderful job of stepping up because, of course, as we know, this is really an unprecedented situation. We've had to deal with power outages and storms and different things, but, this is putting a challenge on everybody. So our outpatient providers, similar as to the mental health side, they're doing almost primarily telephone services, providing in-person services when needed. Our medication-assisted treatment programs, some of our programs are quite large, others not as large. So they've instituted a policy on dosing times that are very specific for clients, as well as minimizing the number of people that are allowed to come into the building. So for the most part, they're actually doing almost like curbside services. So the nurses are going out to the lot to dose people in their vehicles so they don't even have to leave their car and risk any exposure that way. Their counseling services are being done telephonically, and even some of our programs have used technology to do group as well. The state and the federal government has opened up for our medication-assisted treatment. After a week or two into the COVID situation, they did allow for more leniency with the take-home medications. So that made a great impact on the number of people having to show up at the clinics. So that was a really good thing for us. Our residential providers are continuing to provide services for the most part. We do have two of our smaller programs are at capacity, so they're not taking additional clients at this time. Our largest program, unfortunately, they had 4 staff within the building positive with COVID. 1 is now on a ventilator. So they had to drastically reduce their intakes at this time. So they are restructuring the layout of their building right now so that as they bring people in for the first week, they will each be housed in a separate room with a nurse going room to room and using technology to provide group and counseling services while they're there. And then after that, they know that they're not a exposure risk any longer. They're moving them into smaller settings and groupings rather than larger gatherings as in the past. So, as far as we can do within the circumstances we've had, I think that they've done pretty well and stepped up greatly for that. I know it's very hard on a lot of the clients that we serve because the self-help meetings, they're canceled. They moved to virtual.
Right.
So for some people, a lot of people have phones and different ways to do that, but there's still that isolation, which is really hard in early recovery. We know and are really, unfortunately, expecting to have a lot of fallout from all of this after things settle down more, because we know when people are home, they're more likely to be using many times because of the isolation that's occurring and without the real accountability that they have when they're in person meeting with others. So, you know, I think they're really stepping up and doing everything that they can that way. A lot of our providers, our peer services, have gone to all telephonic services. So where they used to go into facilities and help transitions occur, of course, now they can't do that, but they're still being contacted by hospital emergency rooms, by the jail as people are being released, from the prisons with a couple programs that we're working with. And so they're still able to continue those services, but remotely. So we're glad to see that. And our prevention providers as well are offering up many different classes now to the community online so that they can provide that support as well.
Thank you. That's a really great report. That's a, you know, we worry about all of our, the different divisions and the, with the vulnerable people. So thank you, Helen. Thanks a lot.
You're welcome. Thank you.
Thank you, Linda. Sorry I didn't get to unmute you last time. Any questions about item C with the servers?
Phil?
Yes.
Dave, the Access Interactive entity, are we purchasing from them because was that bidded? Was that sole source? Is that the company we have always dealt with on the servers?
Yeah, they're the current vendor for that.
Okay, any other questions on item C? All right, seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
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 All opposed? Motion passes. Next is item 6, receive and file. I don't have anything. 7 is resolutions. I also don't have anything there. Number 8, other possible agenda items. We'll start out with a reminder of the board study session this Friday morning, bright and early, 7:30 a.m. Be there virtually. And with that, I'll turn it either over to Dave or board members, whoever wants to go first. I think I'll just start with Dave and then we can go to board members.
Thank you, Phil. I have to start by thanking our staff here. They've just been doing a wonderful job across the board. Helen touched on some of the work that our providers are doing as well. They're working together. They're getting very creative and continuing to provide the supports that people need in the community. It's really pulled everybody together, and we're seeing the kind of the best from everybody under some very difficult situations. We are concerned about, on our calls with the state, the lack of personal protection equipment for the staff that are frontline and are providing the personal care, the community living supports. I do have to thank Dr. Serpa. She was able to locate some providers for the personal protection equipment. She purchased some of that on her own to begin with. We did reimburse her for those costs. But we did end up with a conference room full of equipment, and we were able to dispense that out to our provider network to try to help them out as well. We do have some of our staff who were directly impacted by the virus, and we're trying to keep in touch with them to get status reports. We wish the best for them and their family members. Twice a week now, both with the county leadership and the state leadership, we're having COVID-19 check-ins. The response at those levels too has been very supportive. We had a phone call with Al Jansen and Jeff Weifrich from the Behavioral Health and Developmental Disabilities Administration, which is basically, you know, what are we experiencing? Where do we need help? What could they do to support Macomb County? So it's those types of activities that are going on right now. You know, they can't make things happen overnight, but they're moving things forward faster than ever. And Nick, thank you for sharing the 1135 information that was approved by the federal government. So there are actual formal changes to the Medicaid waivers for the state of Michigan during this time of crisis, which have freed us up from a lot of those timeframes, restrictions, need for signatures. They're just saying, you know, go help people, do the best you can, and we'll worry about things kind of on the tail end of all of this. But we are able to get verbal consents to document that in our system. We're working on the final details of that. But it's to the point, we, out of our 7 locations, we've closed 3, including the clubhouse. The clubhouse staff continue to reach out telephonically to the people in the community. First North, we have a tent outside in the parking lot where we're screening people. We're giving the much needed injections. Our nurses have been, you know, wonderful in continuing those services. And we might continue to close some more sites down. I'm here in the administrative offices now. It's definitely a skeleton crew. They came through and wiped everything down, did a deep clean. They also fumigated on Monday evening and will be hitting each of our locations. It's a special cleanser specific to the virus, which is, again, we're doing all we can. Guess those were the quick summary. I did want to mention too, Helen mentioned the opioid health home grant. We did get another grant for the crisis line, and it's a little over $56,000. We are working with the commission now and the appropriations, and I'm pulling Richard Carpenter into that because we've had changes in the finance department. We want to make sure we're dotting our I's and crossing the T's on all of those types of things. So you'll be seeing some information on that coming forward, but it's on the positive side. It's a good thing. And again, thank you, Phil, for the reminder. Friday is our kickoff with Richard Carpenter for the Finance 101, and then there'll continue to be board study sessions, and then we'll get to those routine financial updates, definitely part of the budget part of this committee. So thank you all.
Thanks, Dave. Any board members have anything to add?
I do.
Kathy, go ahead.
Just a question. If we received advanced information, I'm not aware of it for Friday morning, or will we be seeing the material that morning?
We'll double check with Richard. I believe he'll have like a PowerPoint presentation that he'll be talking everybody through.
Okay. It would be helpful if he's got it, but he could send it to us in advance in PDF. So if we want to take notes right on the presentation, because I don't know how to do it electronically.
Will do.
Thank you.
You, Kathy. Any other board members?
Yeah, this is Brian here. We sent out the information on for Friday's meeting to get into it. Because I haven't seen it.
Yes, that came out from Sandy Hayes.
Okay.
But we'll send it again, and if you don't have it, let us know.
Okay, thank you.
I got mine.
Okay, thank you, Brian. Any other board members with comments or questions? All right. Seeing none, we'll move on to hearing of the public. Anybody from the public wishing to speak? Again, you have 5 minutes. This time I'll mention if you are on the phone, please press *6 and make sure your phone is not on mute also. Anybody from the public going once? Anybody from the public going twice? third and final call for hearing of the public. All right, hearing none, we will close the hearing of the public and I will take a motion to adjourn.
So move.
Motion from Nick,
Support.
support from Burke. All in favor signify by saying aye.
Aye.
Aye. All
Aye.
opposed? We are officially adjourned.